Great. Well, everybody, thank you for joining. It's 5 p.m. on the first day, so I'm surprised you're still here. Well, I shouldn't say surprised. I'm surprised there are so many of you here, other than being at the beach outside. So thank you for sticking around. Before we kind of dive in, I'll let Manish introduce himself. Manish, you want to go ahead and introduce yourself? Tell us about your fund.
Sure. Hey, everybody. I'm Manish. Run First Spark Ventures. It's a $300+ million fund, seed through A, co-founded by myself and Eric Schmidt, former CEO of Google. We do hardware, software, wetware. My background is I've done 3 startups in the medical space, 2 software, 1 hardware myself. Probably the company that you all know that I helped put the first check in and is part of most of your lives is Siri for the iPhone. So after doing the med tech world, I moved into the tech world, and I've done everything from Apple picking robots to space situational awareness to Siri to other medical systems. So that's my background, and that's our fund.
Great. And I'm Shabbi Khan. I'm a partner at Foley and Lardner. We're a US-based general practice law firm that represents medtech companies all the way from garage to global. We help them across all different practice areas, from financings to commercial agreements to IP, which is what I do, to even immigration. So to the extent that there are European companies looking to move to the US, happy to chat after. But moving on to today's topic, generative AI, and ChatGPT since November of last year has just taken the stage. And we've kind of gone through this phase of super euphoria, excitement, to some skepticism, to just questions about ethics and where does all of this lie. And so hopefully we can unpack what this means for medtech. I know medtech's definitely one that's not necessarily the most innovative in terms of trying to jump on the bandwagon, and there's rationality involved in medtech. And so let's just start with the first question maybe is, are we in a hype cycle with generative AI?
So maybe I'll just start by asking, and I can do this so I can see, how many of you have used ChatGPT? Okay, that says a lot. How many of you have used Midjourney, DALL-E, or any of those more? Okay, there's fewer, but still some. How many of you have used ChatGPT to ask a question about medicine? Okay, so clearly it's not purely a hype cycle, right? Like there's a lot of people here who have tried it, at least dabbled in it. Of course, there's a bit of a hype cycle too, right? I mean, you've got a situation here where you have these solutions that are fundamentally transforming how you interact with the internet. I'm just going to take 1 or 2 steps back. First of all, this question that I ask, if I ask this question to this audience, I got a pretty high response. If I ask it to a 15-year-old audience, they look at me and most of them don't raise their hands because they assume it's a given that they use generative AI in some form or the other. People are using it in ways you would never imagine. My 15-year-old daughter does not use it to answer questions for her school or write essays, but asks it to write 4 different essays and then decides which one she wants to pick or mix and matches. I know other people who use it to generate artwork that they then use as an inspiration for their own artwork. So very different ways, maybe not necessarily in medicine, but it is being used, and a 15-year-old uses it as natively as we today use the internet. So I think you have to think there is a little bit of a generational difference here in how frequently it's used. Of course there's some hype. Of course it's over. Not everything that generates a character that can be used offline. Yes, I like your kid may like Elsa, but do you really need your child to interact with Elsa via text on an ongoing basis via generative AI? Probably not.
I like the word generational. And when you say generational, if you think about the use of LLMs in health tech, what does the first generation look like? And where does the future go from there?
Medicine's interesting. So I'll give you an example. If you go to Kaiser or UCSF, the number 1 use case doctors seem to be asking for the use of LLMs for is actually to answer their emails. They're just sitting there going, we are spending multiple hours a day at the end of the day responding to emails. Many times the patient has already sent us a question based on the labs that they've received answers to that we haven't yet seen ourselves, and we have to sit and ask emails. We often have to go to 15 to 20 different sections of an Epics or a Cerner or an EHR system to answer the email. If that could be done automatically. So paradoxically, I think the drive in medicine is starting to come from different sources than you would typically expect. People who are tired of doing certain things like that. We're seeing a lot of energy in that area. The other thing to think about is that these systems are improving rapidly. The first generation of systems like ChatGPT is actually terrible for doing that activity that we talked about. Why is it terrible? Once it's trained on data that has no value for the medical domain or limited value. Two, every physician wants to respond in a way that's more adherent to what their practice is, what their beliefs are, their communication style is. So you need things like retrieval augmentation generation, like RAG, and a few other things to add to generative AI that together allow you to do things. So what we're seeing is the driver is actually coming from there. I would make one other point that we're seeing really interesting is in medicine, as a person who does both medical tech and non-medical tech, let me just tell you right at the beginning, the EHR sucks. And it sucks for reasons not what physicians only say, which is it makes their life miserable, which it does, but it sucks because it doesn't have complete information. I mean, I'm going to bet that 100% of you here have had a medical treatment that has worked and never told your doctor that the medical treatment worked. Right? So just think about it. You are missing the fundamental outcome research, outcome data in the EHR. The idea of being able to create synthetically generated data using generative AI for time series data in medicine could be fundamentally transformative. You may be actually able to get the power of AI out of it. So while ChatGPT is probably limited in its scope of what it can do, there is a huge potential in LLMs or generative AI.
Apologize for being late, but also I was impressed, like everything runs on time.
Hey, Luke.
Thank you very much for having me. Yeah.
Great. Just spend a few minutes telling,
Oh,
or a few
yes.
seconds telling the audience who you are, what you do, what your fund's about.
Oh, happy to. So I'm Lou. I'm the founder managing partner of Fusion Fund. We're a VC firm based in Silicon Valley, Palo Alto, mainly focused on healthcare, lots of AI in healthcare, enterprise AI, and industrial automation investment. And I've been mainly focused on AI in healthcare since 2017. So lots of discussion about using different AI model to solve the hardest problem in healthcare industry. And also myself was an entrepreneur. I built and sold my company to Boston Scientific before I went to so-called the dark side, start my own VC firm back in 2015.
Great. Well, maybe I'll pick on you now that you're here. So, the first generation of LLMs, and I think we're starting to see it, right? In chatbots, in the use of using generative AI to maybe complete doctor notes and so forth. But what do you think happens after that? Where are the applications of LLMs beyond maybe just the more simplistic clinical workflow issues?
Yeah, so of course, AI could be a super effective tool to help us solve the workflow efficiency issue. I always said there's a AAA problem within healthcare system: accessibility, affordable, accuracy, and AI could be a perfect tool to help us. But meanwhile, there are more beyond that. For example, we have company been using large language model, generative AI for medical image enhancement since 2019, 2020. So essentially, they could upgrade a low-resolution scan from CT, MRI to a high-resolution scan within a minute. And the accuracy is really good, and also is much cheaper, faster, safer solution. Another thing is we talk a lot about how to apply vertical large language model to a different application, and you have to build up specific, I would say, industry-specific model in order to make it highly professional and accurate. So we see company focus on, for example, have a company focus on Gen AI platform for life science and pharma. Essentially, the scientists from Pfizer and Novartis could directly ask how to design clinical trial for this new medication. And it gave the answer highly professional, accurate right away. So there's more to be explored. For example, another vertical we'll be investing called digital biology, synthetic biology, and there's opportunity for a large language model to be used in that domain as well. But before we talk too much about large language model, I still want to highlight one thing that Gen AI, large language model, is not the only AI. There are so many different AI models, the AI algorithm being used in healthcare sector already. And some of the application not necessarily need to apply large language model, which is supposed to be very expensive as well. So we're seeing in general AI in healthcare is because there are so many broader applications within healthcare could show the capability of AI and vice versa, good for healthcare industry, for example, federated learning. We all care about the sensitivity of the healthcare data. Federated learning is a new algorithm could really help us solve it.
Great. Yeah, one of the, I guess, opportunities but challenges is that people will look at generative AI and say, hey, this is where all the money's flowing. How do I incorporate Gen AI into my company, into my business model? And as investors, what's your view on or advice to startups that are thinking about maybe generative AI, but also AI in general? Like, is there a value proposition that they have to have, and what are the sort of ways they should think about it?
Do you want to
Yeah,
start?
please, you go ahead.
So, yeah, so first of all, around 18 months ago, every company just randomly started adding AI to the title of their pitch decks, right? So, I'm a medical device company with no software component, but I clearly have an AI component somehow, which is impossible to figure out. But so, generative AI also is a buzz phrase, and, you start seeing a lot of it added in the circumstance. So put those aside, right? Like, I think there's real value in many, many cases in AI and in generative AI, right? So yes, we are actively looking at companies that harness it. Whenever a new component technology becomes available, there are new doors that are unlocked. And to the extent that somebody can identify exactly the pathway from where this component technology unlocks a new door, a new market, a new opportunity, of course we will take it very seriously. I think the other thing is data still matters. And to the extent that you can generate some degree of proprietary data or have a very clever way of integrating your proprietary data with the larger data sources that are becoming increasingly available. One of the phrases I often use is, people use a phrase, data is the new oil. I'm not sure I completely agree. I would say data is the new sand. Glass is really important in our life. Glass is what we use, but you need to process the sand to get to the glass. So without the sand, there is no glass, but the sand itself is not sufficient. So the ability to look at that and convert it, I think, becomes where we pay a lot of attention. And if somebody figures that out, it is actually a net real bonus versus a negative, and we would consider it seriously.
That, there's lots of new momentum happening. It's not only just powered by large language model, it's just the improvement of the AI really open up the door for us to explore different opportunity, provide more personalized digital therapeutic solution, digital diagnostic solution, and also go back to what I mentioned early on, digital biology. So last year, we all know within healthcare life science industry, I was super excited about AlphaFold, which kind of opened the door for digital biology, synthetic biology. And meanwhile, now we have large language model Gen AI as another effective tool, work together with AlphaFold. So things like that really give us lots of hope to be able to really achieve the goal of the future of healthcare, which is personalization, right? Highly personalized from the moment of diagnostic to therapeutics. I heard there's a new term called digital medicine. So I hope that's really could happen in the near future. Another good thing is I feel with ChatGPT, with the popularity of generative AI, the whole healthcare system also got the education of understanding value of AI. Not only just the physician and the caregiver, but also the payers, like the insurance company, regulator.
Sure.
They really understand now what is the value of integrated AI and how urgent they have to understand, and also instead of being the road stopper, but also be the supporter to push this wave move forward. I still remember earlier this year, I was on this panel in JP Morgan Healthcare Conference in San Francisco. And across the panel, me and other investors were complaining, there's so many digital therapeutic solutions got approved by FDA, but why insurance companies are now taking action to reimburse it? And a couple months later, I heard lots of insurance companies start thinking about giving reimbursement to digital therapeutic solution because they got question asked from the board, what's going on with this AI thing, with this ChatGPT? So I think that's all the good momentum and also require more effort from the founder investor side to educate the industry better.
Yeah, maybe I'm just going to build on this a bit more. It's a great comment. First of all, look, everybody has wanted personalization. Nobody's been able to deliver personalization in a significant enough way. And with the exception of physicians. Physicians do their level best in the time they have available to deliver personalization, and they have the odds stacked against them. So any means we can provide that degree of personalization, I think is absolutely critical. The second point I would make is, with many of these technologies, paradoxically enough, the consumer comes before enterprise. Even the internet, the consumers adopted it way faster than enterprise adopted it. Even phones, yes, people were using BlackBerrys, but the moment smartphones came, the consumer adopted it maybe 5 to 10 years, sometimes 10 years before big corporations came up with great smartphone-based solutions for themselves, at least 5 years. It is not surprising that while AI was around for the last 5 years, it has been sputtering and medium successful in enterprise situations. It needed this consumer drive, as Lou was saying, for the boardroom members to suddenly say, hey, what's this ChatGPT?
Yeah.
This consumer push is now going to be followed by a massive enterprise push. So arguably the best 10 years to invest in this is now, after everybody has accepted it and understood it, and not before.
Yeah, really good point. I want to share a little bit more about updates, what we heard from all this large corporate. We have a CXO network, just to give you more context, I established in 2018 with Infusion Fund. And we have 44 CTO from Fortune 500 company within this network, including some of the healthcare and pharma company. I remember earlier this year when we were doing our quarterly catch-up, of course, we talk about, data strategy in the age of AI, ChatGPT, generative AI. So I was curious, okay, what's the discussion on the board? Exactly as you said, lots of the board push on the CTO, ask them to really bring in this digital technology or AI to help them build up their data strategy. Another motivation they have is really about the liability concern. Because I was joking with them. I was like, oh, don't worry about AI replace human because we need human to take responsibility. If anything went wrong, especially in this highly regulated healthcare sector, someone need to go to jail for that. I was supposed to tell a joke. Nobody laughed when I tell the joke. They're like, yes, that's true. We're the one taking the liability. So we need to integrate vertical AI solution, data privacy solution sooner than later because our employees are throwing sensitive data into ChatGPT, even we told them not to do so. So there's another push. On one side is efficiency improvement data strategy. Another push is worry about liability. So when we saw our portfolio company talking with large pharma company, large insurance company, they're eager to do the integration sooner than later. They have dedicated budget and increase their budget even to $1 billion level just to dedicate to work with startup for partnership, contract, and merge acquisition. So I hope that's some useful information and encouragement for the startup founders.
Great, that was a lot. I want to touch on wearables for just a second. You mentioned the consumers are going to adopt this technology first. Is it going to be in the form of wearables? Is it going to be in what they expect their patients or their physicians to provide to them in terms of service? Like, where do you see the path for adoption?
Why don't you start and I'll follow?
Oh, yeah, happy to. Yeah, so I don't think it's really limited to wearables. We didn't invest any wearable devices for the personalization. Because on one side, we need to look at the market map in terms of competition. It's really hard to compete with Apple. And another thing is also we're investing, we don't touch anything consumer tech, we're investing clinical level devices and healthcare solution. And the simple wearable couldn't provide accurate enough data to do that. But some new things, for example, smart pill, that's for digital therapeutics, is going through FDA right now. We have a company, and it could basically go inside the body. Still not really invasive, but be able to really collect the live data for the GI system, and also doing personalized therapeutics plan potentially. So I think there will be definitely smaller scale devices involved, but not necessarily on the wearables. Another thing is I feel in the future, the concept of diagnostic will be slightly different. Used to be concept is one point diagnostic, but now there's an extension between clinic to the device at home to the community clinic. How we'll be able to assembling all the data together eventually contribute to diagnostic. I think that's the future.
So I think that there will be new forms of interaction happening here. Again, I mean, just abstracting out to a high level, you have a patient who is fundamentally worried about their health or some aspect of their health, not necessarily knowledgeable. At best, their knowledge is by a quick look on internet, which for some, 10% really helps them, the other 90 confuses them. On the other side, you have a physician who's extremely knowledgeable, has limited time, doesn't necessarily want to tell all variations of what can happen because most of them will not happen. So you have a fundamental mismatch at a communication level. You have an emotional, unlimited knowledge person, you have a hyper knowledge person with limited time, and trying to manage the patient as well. It's fundamentally the worst communication environment you can have. And I would say that the last 20 years, we've tried to say, both from the physician's perspective and the patient's perspective, trying to fix a system that is actually fundamentally challenged by the very nature, whether it was in medicine or not in medicine. So to the extent that wearables, any other communication device can help bridge this fundamental challenged communication system is actually net beneficial for both. I do think that there will be some groups of physicians, some of the more senior physicians who really have identified this problem and want to fix it, but a lot of physicians who are growing up now with it being very native in the system that will adopt it. I think wearables give, again, I'll go back to data as the sand, not the oil. The data from a wearable, whether it's from any group or the other, is inherently problematic just in its raw form for anything medical, right? Like you have to process it in a way that addresses a key need. You can't just say, I've got this and therefore I'm going to solve heart disease. It's not going to happen. So this idea of trying to process it in a way that addresses communication mismatches, data gaps, this is where we see opportunity, and the best companies are already focusing in these areas to fill these needs.
So when you said that physicians have less time, I thought you were going to say less patience. And so the more patience they have, the less patience they have. But does this, but
Very
this,
bad
does
joke,
this,
but go ahead.
does this, does AI provide for scalability? Like, what does this open the door to if we think about the opportunities that it presents itself?
I think absolutely yes is the simple answer here, right? Like, how much time do you spend replying to emails? How much time do you spend looking at insurance claims and dealing with insurance claims? I mean, Lou pointed out that there was a huge role for this on the insurance side, the healthcare tech side. And it's very easy to say, we're a medical device company and we sell medical devices. But when the physicians you're selling it to are living in this world where they're dealing with insurance, they're dealing with emails, they're dealing with this, that means they're spending less time dealing with you. So very simply put, it's very easy to say, this is not part of our day-to-day life, but it is part of your day-to-day life. And to the extent that you understand that and take advantage of it,
exactly,
you'll do much better. Even as a pure medical device maker, you will do better. So I would say, I think it's actually fundamental. And I think that the world 15 years later will be fundamentally different because of these technologies for the physician in almost all positive ways. And relative to the internet, definitely in almost all positive ways that they've had since before.
Yeah.
If we want to talk about maybe patient communications and biomarkers and the future of generative AI in terms of identifying new biomarkers, what does that look like? I understand maybe, from imaging, you can do better diagnostics or get better sort of biomarkers just from imaging. But can we take the conversation further and expand people's views of what that might look like?
Yeah. So first, I feel for lots of imaging, for example, AI pathology, not necessarily we need to use generative AI. We could use, expandable AI to find a better correlation. I think that's the beauty of AI, just to be able to help us process data super efficiently and quickly identify the correlation connecting all the dots. And if we are able, I would say in the perfect words, that now the issue within healthcare system is the data isolation. That we sounds like we have lots of high quality data, but this is California, this is Texas, there's different states, different hospital system. But in the ideal world, if we could combine all the data together and be able to have such a big database and find all the correlation between different diseases, of course, we're gonna find more accurate and a more personalized, more better and earlier stage diagnostic. And also, I think that's another thing, another key question applying AI is we also need to find a better solution to help medical devices startup or different AI in healthcare startup have access to the data. And who owns the data? It's not a startup company. It's a large one. It's a healthcare service provider. So that's the reason I mentioned federal learning early on, that we have some solution available right now. There's more data encryption technology out there. And sooner or later that this data could be accessible by lots of the startup founder. And also, go back to your previous question, I really want to add into that. We've been talking about, okay, AI is a new tool. Tool won't replace human, but the doctor who uses new tool would replace the doctor who doesn't use the new tool, right? And also fundamentally, it's also go to the startup founder. I know the same of the LSI, there are lots of founder focus on medical devices. My previous company was a medical device for type 2 diabetes. And at the time, we're doing a lot of data analysis to help us do super early stage diagnostic already. That was more than 10 years ago. I feel now, since AI is so easy to integrate, development cost is so low, device also have a really perfect position at the entrance of the data. That's super critical. Without the control for entrance to data, don't talk about transfer the data, process the data. So if you already control the entrance of the data, why not adding another layer as a platform play on top of it to transfer data, storage the data, and further process the data, and also expanding the potential access scenario for platform play. So I feel that's kind of the beauty of AI. So to me, it's not really about whether we should. It's like, of course, we should integrate AI, but how? How to use it effectively and efficiently.
Yeah, for sure. So the lowest hanging fruit is integrating lab/imaging data and clinical data. Today, the radiologist reads a report, generates a report. A good chunk of that can be generated in an automated fashion. But then the physician looks at that report, looks at their own clinical knowledge, integrates the two. Those could be done. You could actually do that so that the radiologist report integrates in some of the clinical stuff. Look, if I've got a lesion in in an X-ray, lung X-ray, and I've recently been to India versus I've not recently been to India, changes how the interpretation may be made. Why is it that radiologist makes it in absence of that information and then goes back? So there's multiple sources here, and LLMs can crack that today, right? But there are other new things too. Like so far, if you've noticed, our biomarkers tend to fall in 3 categories: fluids, blood, urine, saliva, imaging, and maybe some extended signals, right? Like think that. Why not? There are companies now that are using transformers and large language models that are detecting depression, suicidality, Alzheimer's, way more accurately than almost anything else, right? So why wouldn't you use those techniques? So part of the adoption of this, the challenge of this is going to be people have accepted blood and fluid markers from the 1500s, 1600s for sure. People have accepted imaging markers from the 1900s or the 1920s, but there was resistance at the beginning. There's resistance right now to new markers that are coming out because of transformers and LLMs that are not in those categories. And that's going to take a 5 to 20 year, hopefully faster, but pessimistically maybe taking 10 years before the adoption happens. That also fundamentally changes things. So I think you've got a brand new horizon coming here in terms of the use of brand new markers that never existed before. And I think we should be pretty aggressive about adopting them. I think in terms of actual devices themselves, look, LLMs are probably not going to be incorporated in your pacemaker anytime soon, and I'm not sure I see a clear need for an LLM in a pacemaker. But I see an absolute clear need for an LLM to be used in patient interaction post-surgery to optimize the effectiveness of a pacemaker or any other implant. So again, if you think about the implant as just the surgery, just the implant, versus the 14 days post-op care or the 30 days post-op care, the answer is completely different.
Yeah, I really want to add on that. I totally agree with what you said, especially first with a biomarker. I invest a lot on mental disease, especially I personally have strong passion for dementia. But if you know the nature of dementia, it's just harder to even find out the specific reason what trigger certain person to have dementia and why this person progress much faster than another. But using AI, we'll be able to identify new biomarker. It's not just a simple biomarker, like a traditional biomarker, new biomarker specific per every individual's situation. So that's really a big kind of potential milestone for the general mental disease vertical. And another thing is, I think for the past many years, even sometimes without certain biomarker and symptom, and we potentially identify what is causes and disease, still challenges are certain symptom is not directly related to what our traditional assumption. And if you go to a doctor as a neurosurgeon and they will think about neurology issue, you went to with a different physician, they may think, okay, it's a heart issue, it's a muscle issue. If you couldn't be able to combine all the information together or find a doctor, have the domain knowledge across different specific sector, maybe you won't got super accurate diagnostic as well. But this issue could be potentially solved by large language model, by just cross-check the information and finding the correlation. So that's really fascinating. So I feel like for the future, I totally agree with you that we should aggressively pursue the understanding of the new biomarker and also welcome all this biomarker and using AI to help us find the most efficient way to matchmaking which biomarker for which disease and take it from there.
So to create just a little bit of controversy, is it too early to start thinking about ethics and regulations, or do you think if you're investing in a company, you want them to have a clear view of what that looks like and what that pathway might result in?
Why don't you start?
Yeah, happy to. I think definitely not too early at all, because if the startup company are now thinking about this issue, that it's hard for them to have conversation with their customer because their customer concerned. The large pharma company or maybe whoever they're partner with is sharing the data. So have to think about it earlier than later. Of course, we also are hoping the regulation could come along to give certain guidance. But unfortunate, in the history of technology innovation, regulator always came the last, and we couldn't rely on government to essentially give the guidance, right? They also want the private sector to get more education. But the good news is, from what I heard from my venture partner, Rahini, she just left White House half a year ago. Seems like both parties really don't want to be the showstopper for the AI. And meanwhile, very open to talk with the industry leader in order to understand what is the proper regulation should be put in place in the future. And then another thing is what is the regulation should be? Is a regulation for technology or regulation on data? I personally think the regulation should be focused on data because essentially the thing should be regulated is what being processed by AI and who gonna use AI. We're gonna be processed by AI, it's the data. Who gonna use AI? It's us.
Yeah, so I'll start by saying one of our companies in the non-medical area, which is doing extremely well, we funded it a few years ago, does the following. If you're a kid who wants to work with a synthetic character in Little Mermaid versus a person who wants to deal with a synthetic character in Friday the 13th, it automatically creates completely different guardrails and characters. If you are doing that in the consumer world, and it is the right thing to do in the consumer world, heck yes, it's important to think about ethics and policy in the medical world, right? Like if that's the discussion. I've been to DC many times talking about the ethics, and I'm on one of the panels that is dealing with the AI side of things. It's going to be very hard for regulators to regulate AI per se. They just, the lack of knowledge and the speed at which the field is moving is almost impossible. I would agree that in areas where the data is sensitive or data is owned or data is manipulated, there needs to be very clear guidelines on who owns it, who gets manipulated, who gets to make decisions on it, who gets to use it in a particular way. And I think, the good news is a lot of these things are, technology is also handling some of these things. There's techniques such as federated learning right now, which is never take the data from any one place, leave it where it is, but do all the analysis you want. So there's a lot of new technologies that are starting to handle this problem because they know if they don't handle this problem, the rules are going to come in and they're going to be harder. You probably need both. You need the rules and the technology, but I think we're starting to converge there. I'll just make maybe one last comment here, which is the generational element is important. Today, 20 years ago, you could graduate with a biology degree and do very little math. Today, there is nobody graduating with a biology degree without at least math, almost certainly Python programming, and almost certainly data sciences at the minimum if you didn't do programming yourself, probably both. So you got to imagine a 21, 22-year-old graduating from college today in biology, maybe becoming a physician, maybe not, has such a fundamental different interpretation of biology than somebody who graduated 20, 25 years ago. So I would say, we've in the past had great biologists who didn't do math and great physicists and mathematicians who participated as a collaborator in biology. Those two worlds are merging. And it's a beautiful thing, and it's a great thing they're merging. So I think a lot of these discussions are going to build upon the fact that there's going to be a new group of folks, which we're all going to be working closely with in our careers, that are going to treat things more intuitively and inherently and make the right decisions in many cases more intuitively and inherently than us who have to think about, should I be hitting this stroke in tennis versus not thinking about it and just hitting the right stroke, right? So that's a very big difference.
Great. Well, I think we're out of time, but I thank Lou for joining for sure. Definitely enhanced that conversation. And Manish, thank you again for participating. And thank you all of you for spending time with us as opposed to on the beach. So you're free to go to the beach if you want.
Yeah. Take care. Thanks, everybody.
Thank you.